10 warning signs you are nutrient deficient. Did you know that more than 2 billion people in the world today are estimated to be deficient in key vitamins and minerals? You must understand that our bodies require a delicate balance of essential nutrients to function at their best, and these nutrients are primarily obtained from our regular diet. However, in the hustle and bustle of modern life, the proper balance of these key elements often gets disrupted, resulting in some signs. Today, we'll explore 10 such warning signs. Understanding these signs may be a crucial step in your journey to better health. Always consult your healthcare provider if you suspect that you have a deficiency. Also, you must consult a dietitian before making any changes to your diet. Without any further delay, let's get started. 1. Fatigue and weakness, iron deficiency. When your iron levels are insufficient, your body can't produce an adequate number of red blood cells, resulting in anemia. It results in a decrease in the amount of the protein hemoglobin, which is responsible for carrying oxygen throughout the body. When the tissues and muscles do not receive an adequate amount of oxygen, it impairs their ability to carry out their general functions. This may result in symptoms such as exhaustion, weakness, and a general feeling of being tired all the time. Then the body tries to compensate for the lack of oxygen by making the heart work harder, which may result in an increased heart rate and shortness of breath. A study that included over 28,000 women between the ages of 18 and 50 found that those who reported having a low iron deficiency had lower physical health scores as well as higher levels of fatigue. It was also found that middle-aged women who had recently been iron deficient within the last 2 years had a 3.2-point drop in their physical component summary, or PCS, scores. Remember that adult men should get about 8 milligrams of iron every day, while grown women should get about 18 milligrams. Also, you may mitigate iron deficiency easily by consuming iron-rich foods like lean meats, beans, lentils, and fortified cereals. 2. Hair loss, biotin deficiency. Vitamin B7, also known as biotin, is an essential nutrient for maintaining healthy hair, skin, and nails. It is a coenzyme that assists in the various metabolic reactions involved in the synthesis of fatty acids, the breakdown of branched-chain amino acids, and the production of glucose, all of which are necessary for the maintenance of healthy skin and hair. In addition, biotin is an essential component in the manufacture of keratin, which is a protein that is responsible for giving hair its structure. Hair may become brittle and more prone to breakage when its levels are insufficient, which may ultimately lead to a loss of hair. A lack of biotin was discovered in 38% of women who reported experiencing hair loss. In an older study from 2012, women from the age group of 21 to 75, who thought their hair was getting thinner, took a hair growth supplement for 6 months. They could see an improvement in their hair's overall volume, thickness, and coverage of the scalp. For adults, the daily recommended amount of biotin is around 30 micrograms, which you may easily fulfill by having foods such as eggs, nuts, seeds, and whole grains. In addition, biotin supplements may be purchased. However, before using them, it is recommended that one seek the advice of a qualified medical professional because deficiencies are uncommon. 3. Brittle nails, iron or zinc deficiency. A deficiency in either iron or zinc, both of which are essential for preserving nail health, may be the cause of nails that are easily broken and brittle. As we have previously mentioned, iron deficiency may lead to fragile nails because it is essential for the production of keratin, the protein that forms the structure of nails. A zinc deficiency, on the other hand, may cause abnormalities in the growth and development of the nails. It is possible that nails will grow more slowly and may not have the appropriate structural integrity, which will cause them to be more prone to cracking and weakening. In addition to that, a zinc deficiency may be a contributing factor in the dryness and cracking of the nails, which makes them more prone to breaking and splitting. It may be difficult to believe, but approximately 15 to 20% of people all over the world have zinc deficiencies. According to one piece of research, a prolonged treatment with zinc at doses ranging from 20 to 30 milligrams per day appears to be effective in improving brittle nails. Incorporate foods high in zinc, such as nuts, seeds, and dairy products, into your diet to strengthen your nails. 4. Muscle cramps and twitches. Magnesium deficiency. Magnesium is involved in regulating the contraction and relaxation of muscles. It acts as a cofactor for various enzymes that control the movement of ions, such as calcium and potassium, in and out of muscle cells. This movement of ions is essential for proper muscle contraction and relaxation. When magnesium levels are insufficient, muscles may become hyperexcitable, leading to cramps and twitches. Moreover, magnesium is also necessary for the transmission of nerve signals to muscles. When there is a deficiency of magnesium, nerve signals may not be properly transmitted, leading to muscle contractions that are prolonged or uncontrolled, potentially resulting in cramps. But how much magnesium do you need to have a fit body? The recommended daily intake of magnesium for adult males is approximately 400 to 420 milligrams, while for females, it's around 310 to 320 milligrams. To alleviate magnesium deficiency, incorporate magnesium-rich foods like leafy greens, nuts, seeds, whole grains, and legumes into your diet. 5. Poor night vision. Vitamin A deficiency. Vitamin A is crucial for maintaining the function of the eye's light-sensitive cells, known as rods and cones. A deficiency in vitamin A may result in poor night vision, making it challenging to see in low-light conditions. Keep in mind that night blindness is one of the earliest signs of vitamin A deficiency. Moreover, vitamin A is also essential for the health and integrity of the cornea, the clear outer layer of the eye. A deficiency in vitamin A may lead to a condition called xerophthalmia, which may result in dryness, damage, and even blindness if left untreated. In addition to that, vitamin A supports the immune system's ability to defend the eye against infections and inflammation, helping to protect the eye's surface and internal structures. As we age, cataracts form inside the eyes, making vision blurry. A study has suggested that vitamin A intake demonstrated a significant association with decreased cataract risk up to 0.831. To improve night vision and overall eye health, one must consume around 700 to 900 micrograms of vitamin A. Foods such as carrots, sweet potatoes, spinach, and kale are super rich in vitamin A. 6. Dry, flaky skin. Vitamin E deficiency. Vitamin E is a potent antioxidant that helps protect skin cells from damage caused by free radicals. When there is an inadequate supply of vitamin E, the skin may lose its ability to retain moisture and maintain its natural barrier, leading to dryness and flakiness. Vitamin E may help reduce the appearance of fine lines and wrinkles, contributing to a more youthful complexion. It does this by shielding the skin from the damaging effects of oxidative stress and stimulating the production of collagen. The researchers investigated the levels of serum vitamin E in patients with atopic dermatitis across 4 different studies, encompassing a total of 259 cases. The results showed that people with atopic dermatitis had a lower standardized mean difference, SMD, of 1.08 in their vitamin E level compared to those who don't have this skin condition. 7. Numbness and tingling. Vitamin B6 deficiency. Vitamin B6 is involved in the synthesis and metabolism of neurotransmitters, including serotonin and GABA. It also aids in the formation of myelin, a protective sheath around nerve fibers that facilitates nerve signal transmission. When there is a deficiency of vitamin B6, these nerve-related processes may be disrupted, leading to peripheral neuropathy, which is a condition characterized by damage to the peripheral nerves, especially those in the hands and feet. Numbness, tingling, and a pins and needles sensation are common symptoms of peripheral neuropathy. These sensations may be uncomfortable and may progress to muscle weakness and loss of coordination if the deficiency is not addressed. In a study that involved 40 patients, 20 of them were given vitamin B6 in doses of 120 milligrams per day for a period of 3 months. In comparison to the people who did not take the supplements, they reported significantly less pain, numbness, and tingling in their hands, as well as an improvement in sensory nerve conduction. 8. Cracked corners of the mouth, Riboflavin deficiency. Angular cheilitis, also known as cracked corners of the mouth, is a condition that may be an indication of Riboflavin deficiency, which is also known as vitamin B2 deficiency. Riboflavin is an important nutrient for maintaining healthy mucous membranes in the mouth as well as healthy skin. When there is not enough riboflavin in the diet, it is possible for the skin at the corners of the mouth to become dry and cracked. This may lead to discomfort and, in the worst case scenario, even bleeding. According to the recommended daily intake, an average adult should get somewhere between 1.1 and 1.3 milligrams of riboflavin each day. This condition may be remedied by eating foods that are high in riboflavin, such as dairy products, lean meats, green leafy vegetables, and whole grains. 9. Bleeding gums, vitamin C deficiency. Vitamin C is essential for the synthesis of collagen, a protein that is a key structural component of connective tissues, including those in the gums. Collagen provides strength and integrity to the gum tissue and blood vessels within the gums. When there is a deficiency of vitamin C, the collagen fibers in the blood vessel walls become weak and fragile. This may make the blood vessels more susceptible to damage and rupture, leading to bleeding gums. Inflammation of the gums and scurvy are 2 additional potential side effects of an inadequate intake of vitamin C. When the gums are inflamed, they are more likely to bleed when pressure is applied to them, such as when brushing the teeth or eating. A significant drop in vitamin C levels was found in patients with oral cancer, according to the findings of a study. Because of this, a lack of vitamin C is considered a risk factor for the development of oral cancer. Studies indicate that the daily recommended value of vitamin C for adult men is 90 milligrams, while for women it is 75 milligrams. In addition, you may fulfill your vitamin C intake through numerous fresh vegetables and fruits, including broccoli, green peppers, tomatoes, green leafy vegetables, oranges, pineapples, papaya, and lemons. 10. Difficulty concentrating, omega-3 fatty acid deficiency. Omega-3 fatty acids are an essential component of the membranes of brain cells, particularly neurons and synapses, which are the points at which communication takes place between different brain cells. In particular, DHA may be found in high concentrations in the brain, where it plays an important role in the upkeep of the structural integrity and fluidity of the cell membranes. It is possible that cognitive function will be affected when there is an inadequate supply of these fatty acids, which may lead to difficulties with concentration and memory. Several studies with a combined total of about 1,300 participants have been conducted to investigate the significance of these fatty acids. It was found that supplementation with omega-3 led to improvements in learning, memory, and cognitive well-being, as well as increased blood flow in the brain. What impact does nutrient deficiency have on our health? Deficiencies in various nutrients may have a significant influence on our health, disrupting a variety of bodily functions and contributing to a wide variety of health problems. The following is a list of the most significant negative effects that an inadequate intake of nutrients may have on our health. 1. Weakened immune system. Nutrients like vitamin C, vitamin D, and zinc are essential for the proper functioning of our immune system. A deficiency in these nutrients may reduce the body's ability to fight off infections, making us more susceptible to illnesses, including common colds and respiratory infections. 2. Anemia. As you already know, iron and vitamin B12 are critical for the production of hemoglobin, the molecule that carries oxygen in our blood. Anemia, which results from deficiencies in these nutrients, may lead to chronic fatigue, weakness, and impaired cognitive function due to reduced oxygen supply to tissues. 3. Poor bone health. Calcium and vitamin D are vital for maintaining strong bones. A deficiency in these nutrients may lead to bone loss, increasing the risk of fractures and osteoporosis, a condition characterized by brittle and fragile bones. 4. Nerve and cognitive problems. Remember that vitamins like B6 and B12 are essential for nerve function and brain health. Their deficiency may lead to neurological symptoms, including numbness, tingling, poor memory, and difficulty concentrating, affecting both cognitive and physical well-being. 5. Gastrointestinal distress. Fibers are extremely useful to keep us full. Inadequate intake of this nutrient may lead to digestive issues like constipation, while a lack of probiotics may disrupt gut health, potentially leading to gastrointestinal disorders and discomfort. 6. Cardiovascular issues. Potassium and magnesium both contribute to the control of blood pressure and the maintenance of healthy heart function. A lack of these nutrients has been linked to elevated blood pressure, as well as an increased likelihood of developing heart-related conditions. 7. Mood disorders. A number of nutrients, such as vitamins B and omega-3 fatty acids, play a role in the regulation of mood as well as mental health. The insufficiency of these nutrients has been linked to mood disorders such as anxiety and depression. 8. Increased risk of chronic diseases. As the body's normal physiological processes become disrupted, prolonged nutrient deficiencies may increase the risk of developing chronic diseases such as type 2 diabetes and certain types of cancer. You will be able to better recognize potential deficiencies in your diet and take steps to address them if you have a better understanding of these 10 warning signs and their underlying causes. It is essential to ensure that you meet your daily nutritional requirements by consuming a diet that is well-rounded and contains a wide variety of foods. If you suspect that you have a deficiency, you should speak with a medical professional to receive an accurate diagnosis and get advice on how to treat the deficiency through alterations to your diet or the use of supplements to improve overall health and well-being. We have discussed the many warning signs related to nutrient deficiency, but as we know, our daily diets play a crucial role in maintaining our overall health. If you are looking for more food-related videos, here are a few more we recommend you check out. Watch 12 foods that are destroying your heart and clogging arteries. Or try 10 superfoods that can help protect your kidneys from damage. Go ahead, watch one, or even better, both. Do you suffer from any specific nutrient deficiency? Tell us in the comments section below.